Croesawu pawb I gyfarfod Cyffredinol, Blynyddol, Bwrdd Iechyd, Addysgu Powys. Welcome everybody to the annual general meeting of Powys Teaching Health Board. Please accept my apologies for the slight delay in the start. And before we begin, I'd like to provide a brief technical introduction. So we're using Microsoft Teams today, and this means that not only can you watch the meeting, but you can also take part. On your screen, you should see a tab with a question mark on it, and this will normally be in the top right of your screen. If you click on it, it gives you the opportunity to ask questions. And so during our question and answer session, which will take place about 3/4 of an hour into our meeting today, we'll be able to pose your questions to the members of our board. But please accept our apologies. We may not be able to answer all of the questions during today's meeting, but we will publish a summary afterwards on our website. Now, Microsoft Teams also offers you the opportunity to see live subtitles of today's proceedings, and you should see a button in your settings to switch on those subtitles. We've made them available in Cymraeg and English, as well as Arabic, Polish, Bulgarian, Slovak and Urdu. And today's meeting is also being recorded. Now, don't worry, it doesn't share the information about you in the audience, just the presentations and the people that you see on your screen today. And that means the meeting will be available for you and others to watch on YouTube and on our website. So thank you very much for joining, and our AGM will now begin.
Good afternoon. Good afternoon and welcome to everybody. My name is Melanie Davis. I'm the Vice Chair of Powys Teaching Health Board. We would have been joined normally and presented with Vivian Hartwood, the Chair, but unfortunately she hasn't been able to come online at the moment. So I am going to read her statement for everybody to outline today's events. So it's unfortunate the second year running we've been unable to hold our AGM in person given the current restrictions. I do, however, hope that our staff and the people of Powys are able to benefit from this accessible but rather different way of working. 2020-21 was an extraordinary year. The global pandemic has required us all to live and work very differently, and it continues to do so. This is certainly true of the way in which the development and delivery of healthcare has taken place for our Powys population. The achievement of health services with other public, voluntary and third sector services over the last year has been incredible, supported and underpinned by tremendous partnership and strength of community. Whilst the year has been challenging and staff have faced unprecedented pressures and demands, there has been incredible collaboration, determination and ambition seen across all teams, for which we are very grateful. Throughout 2021, at board level, an agile response to governance was required. I'm delighted that it is the structured assessment review for 2020, Audit Wales concluded that the Health Board had maintained good governance arrangements during the pandemic. Whilst planning and response to the pandemic was a significant focus for the board during the year, there were also some other significant decisions taken in support of our long-term health and care strategy. I hope that you will see within our annual report 2021 the exceptional achievements of individuals and services to ensure the ongoing delivery of healthcare throughout the year. This of course includes the phenomenal effort in establishing and delivering new services in test, trace and protect, and COVID-19 mass vaccinations. We are proud to have performed exceptionally well in the delivery of these new services this year. I extend my sincere thanks to our staff, stakeholders and partners for the extraordinary contribution during 2021. The proceedings this afternoon will be led by Carol Shillaby, our Chief Executive Officer, who will present our annual report for 2021 and the annual plan for 21-22. Pete Hopgood, our Director of Finance and IT, will present the Health Board's financial position for 2021. Finally, we will have some questions and answers with the board, and we hope to close this meeting by 3 p.m. I'm now going to hand over to Carol Shillaby, our Chief Executive, who will proudly present the highlights of our annual report for 2021. Thank you very much. Carol?
Prynawn da pawb, Carol Shillaby Ydw. So good afternoon everyone, I'm Carol Shillaby and I'm the Chief Exec of the Health Board, and it is absolutely with pride, Mel, that I present this afternoon the overview of the Health Board through the last year, and I think we probably need some more words in the English language to describe the last year. We have overused, I think, unprecedented. But what I hope to be able to share is at least a flavour of the challenges, the opportunities and the progress that has been made. But if I could start by paying tribute to staff across the Health Board and the wider NHS in Powys for their phenomenal contribution over the last year in the most extraordinary circumstances, and extend that thanks to staff across partner health systems both in England and in Wales, our partners more generally and particularly in the third sector, in local government, fire and rescue and other public services, and of course instrumentally thanks to people in our communities right the way throughout Powys. It is with your dedication and commitment that we've been able to make the progress that we have here in the county of Powys. So my sincere thanks to you all for the part you have played in this pandemic year. So I'm going to run through a few slides. I've got quite a lot, so I'm not going to touch on the absolute detail, but I do hope that people who are engaging with this annual general meeting will find a little opportunity to have a look at some of the detail in the slide pack and also to spend some time reading our annual reports. There's also many other papers, and one of the benefits, if you like, of having digital access is that hopefully people have got the opportunity to become more familiar with their local health here in Powys. So I'm just going to move to the next slide. Thank you very much for that, Caroline. The next slide will just give us a reminder that I'm really just trying to pull out the key achievements and challenges and the significant areas of performance in the last year. So I want to apologise up front if you think there was something important to say that time today has meant we haven't been able to cover it, but there is much more detail in other reports. So the next slide, please. I'm starting with what were our strategic priorities for the year 2020-21. And to be quite straight with you, we didn't start with these priorities. We finished the previous year, 1920, by submitting our IMTP. I remember the meeting so well in January 2020, following the usual process. And then by February, beginning of February, that was very clearly not going to be the plan for the rest of the year. So very swiftly, as boards are required to do, we set strategic objectives in what was a very changing context for us, and things were happening very, very swiftly. So you'll see that the COVID response was an absolutely significant strategic priority and dominated very much of the last financial year. But you'll see the range. I won't go through them all, but we will touch on these aspects as we go through the slides, and there is a comment on each and every one of those. But I just want to draw out that not only were we dealing with the pandemic, but we were also exiting the EU. So two very big changes as well. And then as we reached the end of this financial year, and we passed the Christmas period, which was very challenging, second wave, we started planning ahead and preparing for the year we're currently in. So I will touch on that at the end of the presentation. It will take about 25 minutes and I will hand over to Pete. And just to say that because we had an extended start, we will run through till 3:15 today. So you will have a chance to ask questions. Again, I'm going to just do the headlines here, but we'd never heard of Test, Trace and Protect 18 months ago, but I would say well over a year or so now, we had to establish a brand new service that would enable us to test, trace and protect the people of Powys, and delighted that we were able to achieve this in partnership with Powys County Council. So at the headline level, this service was established very swiftly. I'm very, very proud of the high performance levels that this service has achieved throughout the whole period. It significantly expanded, including taking into the service a mass vaccination call handling service for part of the year, and that enabled us to be as responsive as we possibly could to the needs of the public. At the end of the year, over 99% of index cases and 100% of the contact cases were followed up within 48 hours. And you can see that just shy of 120,000 PCR tests were undertaken for the population here in Powys. We had drive-through, we've had a walk-in, we've had mobile, we've now got lateral flow device test kits available in libraries. So you'll be able to see the tremendous progression of this testing, tracing and protection service that we've put in place. The next slide, please. Focuses also on the COVID-19 response and in particular the vaccination programme. This area in particular has been subject to public engagement events, question and answer events, and the links to those will be available on our website, but I'm delighted to be able to update everyone in terms of the vaccine programme. Remembering this is large scale rapid programme. The permissions from the JCVI to get going on this programme were not really received until the very beginning of December. We were vaccinating on the 8th of December. Our ability to extend right throughout the county, and again, a very mixed model of provision with 3 mass vaccination centres, some pop-up vaccination provision, primary care, and huge thanks to our colleagues in primary care, and mobile vaccination have all come together to enable us to be the best performing health board in Wales. And as we know, Wales has been leading the way in the UK on vaccination rates. So we're very, very proud of everyone who's been involved in this programme, and in particular, huge thanks to the Powys population who have come forward in hordes and droves, so thankfully for this vaccine. And so if I can share with you that over 90%, so 9 out of 10 people and 8 out of 10 people have had their second dose. So all of the milestones have been achieved ahead of schedule, so we weren't due to finish our call for second doses actually until the very end of July. Now, we've done that in June, and so I think for those people who've been involved in this, it's been a very exciting and rewarding endeavour. And I would just like to particularly draw attention to the fantastic contribution of volunteers who have helped run our vaccination programme, but also fire and rescue services who've been vaccinators, and the military, and they've all worked with us as a health board and with the local authority to help make this happen. I just want to point out the chart at the bottom right. What we're aiming to do is to get the blue bars right the way across from left to right, and you can see the top groups have more or less achieved that in completion. And as we move down the age ranges, the one area that, or the 2-3 areas that we're trying to still progress for the second doses are those in the age groups from 18 to 49. So a little plea from me, if you know people who've yet to come forward for either their first or their second dose, there is a fast track and priority access process on our website. Please do encourage people. We can also offer advice and support for those who may be feeling a bit hesitant. But huge achievement on the vaccine programme. Next slide, please. We have been trying to work in a much broader way than on COVID. Of course, COVID has been hugely dominating in all of our lives the last year or so, but we know that there are other elements that are important too. So through the last winter, our influenza, our flu vaccine uptake increased. That's really, really important for winter viruses. And if I can put a plea in for this coming winter, it is so essential for as many of us as possible to take up the flu vaccine, more important than ever before. But you will see that those rates increased. You'll also see that there was an increase and a sustained performance for vaccination for children. And of course, you know, we know that vaccination works. We know that it is a relatively inexpensive way of protecting people in a mass type of way. And we start that journey with children. So I wanted to point that out. And then some of the broader prevention and population health programs about active, healthy families, about small and healthy children, really our work on obesity and weight management, and supporting families, particularly new families with their own mental health and behavioural support. So there's lots of detailed information in that slide for those who want to spend a bit more time looking at that, and that'll be on our website. The next slide, please. One of the really important things for us was to try to make sure we were caring for people who had COVID, but also caring for people who didn't have COVID but had health needs. And the world didn't stop because of the COVID response. We still have people who were falling ill with other issues, and people who sadly would have been having care and support in a different way, and we had to modify the way in order to protect them and to protect our staff. But I can say that with those challenging circumstances at a headline level, we were able to manage to provide essential services. Now, those essential services are defined by the World Health Organization and promoted particularly by Welsh Government. So there's a whole list of them there for people. And we recognise that we had to provide these services in a very different way, often digitally or by phone, rather than seeing people face to face. And on the left-hand side of the slide, you will see some of the detail there about what we did to be able to manage both COVID-related presentations, so investment in estates, investment in care homes, investment particularly in PPE and supplies and distribution. And although it was very, very tight at times, we never ran out of PPE. We always made sure there was a secure supply. But primary care actually maintained, and although a very different way of working, that remained open. And we were able to bring forward innovative changes, so rehabilitation and recovery for long COVID, some of the different ways of supporting people with physio and rehab. So I'm incredibly proud that the staff across the health board and the wider primary care services were able to innovate so quickly in the face of such significant challenge. And the next slide, please. But there have been some challenges in maintaining the services. As everyone will know, that non-essential care was suspended for some time during the first wave, and that we work across the border with a number of colleagues, whether that's the English border or our borders with other Welsh authorities. And you'll see it's not about the detail, but the demonstration here of our work across all of the places where our population, our residents access healthcare, to understand what was happening in their settings. We were tracking that through and looking to communicate that as effectively as possible. Very important work with our partners, because we know the complexity of healthcare provision for the people of Powys. Our job is to try to, wherever we can, simplify that. The next slide, please. Planned care, this is largely about operations and outpatient appointments, and we know that there's been a significant impact on those. And I think it's fair to say we're genuinely very worried about the numbers of people who are waiting now for access to planned care. There's a lot we're trying to do about this, but we have seen demand, so the numbers of people and referrals coming through above the levels of that even before the pandemic, and our ability to see as many people in the service is more limited because of the infection control circumstances that we're working with. And so this is going to be a real challenge for us, as it is for every other health board and trust in the UK, and we're working collectively with other people. But you'll see by the shape of the graphs that there were more people waiting, particularly over a year, and that has got to be one of our key priorities going forward. Next slide, please. And these are just to try and demonstrate, for those of you who like a good graph, you can see the numbers sadly going up, and this is about people who access care outside of the Powys County, and we're determined to work with those colleagues to try and support better access for people. And we know that England's services are pushing forward, as now our Welsh services, and so we're working right the way across all of our boundaries here. Next slide, please. On unscheduled care, we know that people, when the lockdowns were on, were not accessing urgent and emergency care in the same way. So attendances at A&E went down. We did develop phone first so that we could very safely accommodate people as they needed to be supported with access. So again, some good things have come out of that, things that we've learned. Some things will keep, some things will change. But we also know that the ambulance service has been under huge pressure, and that's as much today as it has been through the pandemic, actually. And it would appear certainly that at the moment we've got pressures akin to winter. So all of that sort of demand and need for health services is coming through very, very swiftly, and we're having to work at one of these very challenging areas of ambulance provision and the pace and the speed of the response. But one of the things we've been really successful at during this last period is helping people who have been to hospital get back home as quickly as possible. And people tell us they want to be at home first rather than a hospital. And so we've reconfigured some of our resources and our services to be able to support that. So more support for people to go straight home rather than have to come to a community hospital. But then when people do come to a community hospital, there's very active support to get them home really quickly. And there's some really positive feedback that we'll be taking forward into the future from that approach. And if I can just make a particular mention of the community support during the pandemic. So the voluntary sector, community connectors, those wider community support networks being established and built upon, and have been hugely successful, and something that we will want to maintain going forward. Next slide, please. Mental health. I've got to say that I think every day now I hear conversations about mental health, and if we were to spin back 5 or 10 years ago, we would hardly have heard people talking about it. And in many ways, that is a fantastic achievement of our society here in Powys, Wales, and in the UK, that we're all becoming slightly more comfortable with talking about our mental health. We all have mental health and well-being as much as we have physical health and well-being. And actually, the more we talk about that, the more we're able as a service to provide the right support. Much of this is about support at what we call sort of the lower level, some talking therapies. And I just want to point out the Silver Cloud development that Powys is leading for all of Wales. And over 12,000 people have come through that since the launch back in September of last year. So not even a full year at this stage, and over 9,500 of those are people coming forward themselves. So if we can encourage people to access that support, it's highly effective, and it really does help people to manage before things can escalate. So our performance on mental health services is robust. Despite the COVID challenge, we have prioritised mental health as a health board, and we're really committed to supporting people right the way across the length and breadth of Powys. Our children and young people have been particularly affected by the pandemic, and those who have a neurodevelopmental challenge, be that autism or ADHD or some other neurodevelopmental condition, and we're working very hard to try to catch up on those services because they have been affected, particularly because we couldn't do some of the face-to-face work. Next slide, please. Quality, safety and experience. Just because we've been in a pandemic does not mean that we have not been paying absolute attention to the quality, the safety and the experience of the services that are being provided. And I'm really pleased to share with you the progress that has been made. Right at the start of the pandemic, so back in January 2020, the board approved the clinical quality framework, a fundamental framework for us in the health board. And we have, despite all of the challenges of the year, made progress in relation to these aspects. And in particular, if I can pick out the infection prevention and control transformation really that has happened, clearly in light of such a tremendous public health emergency, of course that's going to develop, but I think it has accelerated forward beyond anything that we could have hoped for or envisaged. But we've been strengthening the way in which we respond to concerns and complaints. We've been looking at clinical case reviews, particularly where one of our patients has died. We've set up learning and improvement networks so that we can share the things that go well, and we can actually share the things that don't go well and learn those lessons. Next slide, please. In the midst of all of this, of course, was a really key service change, and this relates in particular to South Powys. So the Neville Hall Hospital, as part of the clinical futures work in the Aneurin Bevan Health Board and the early accelerated opening of the Grange, Neville Hall changed what it was able to do, and we planned many years ago, made the switch from Neville Hall to Prince Charles Hospital. And I've got to say that this work was very time truncated, very intensive, and I'm delighted to say that that change happened with very little by the way of challenge and incident. And that, I think, is testament to the amount of work that the teams, not just in Powys Health Board, but across the other health boards and the ambulance service put in. And our thanks go to the Community Health Council as well for their support in here as at this point. Still more work to do. Phase 2 is underway, but I wanted to particularly flag that important change. Thank you. Next slide. I've just got a couple left that I'm going to run through pretty quickly. At a headline level on workforce, we have expanded the number of people that have joined the health board, and of course that reflects new services being established, test, trace and protect and mass vaccination. But I would like to say that there are some real challenges underneath that in terms of workforce, and we've also been impacted on the ability to be able to staff all areas all of the time, and we're working with those areas that are most challenged at the moment. Next slide, please. Important during this time, I think, to really focus on staff wellbeing. And we are, after all, a health service, and we know that we will deliver better care when our staff are well cared for and supported. So this slide, I can't possibly do it justice in the small amount of time that I've got available to speak. But this slide shows just some of the elements of the work that's been delivered to support staff. And a huge thanks to all managers, leaders, and in particular the Workforce and Organisational Development team, the Occupational Health team and Public Health colleagues for supporting so much of this work that is helping to help our colleagues across the health board and in primary care. Next slide, please. On a really positive note, and I really wanted to put this slide in because this is about investing both in staff here now, but also in the future staff who we hope will come and work in the health and care sector in Powys. This is a development, the Health and Care Academy, that is being undertaken in partnership with the local authority, with the third sector and with others. And we're absolutely delighted that this Health and Care Academy is now getting off the ground, because it offers some real opportunity to local people to do their training, their development and enter employment, good quality employment in Powys. Next slide, please. On digital, and it's been the year for digital. Here we are yet again doing our annual general meeting via digital, and there's been many benefits as a result of it. And you can just read for yourself some of the elements that we're particularly demonstrating as being taken forward. There's a lot more to do, and I think we've taught ourselves that we can be ambitious when the needs must, in terms of use of digital technology to support people. And we know that it doesn't suit everyone, and we need to be flexible around that, but it has brought a new type of capability, a new type of service into practice. We've still got some challenges, so cross-border and the use of digital technology across different care pathways is still going to be something we're working on, but we've made enormous strides. Next slide, please. Innovative environments. Just want to say that a huge thanks actually to the Capital and Estates team in the Health Board, because they've absolutely worked their socks off this year in helping us to be COVID prepared, and a huge number of transformations in our clinical environments to support that, whilst also trying to take forward some of our really big developments. So we are now on site at the Machynlleth Health and Care Hub. The full business case has been supported, 14.9 million, £15 million investment. That is a really major, a significant development for us. The Llandrindod Wells programme business case, again, going forward into Welsh Government, and the North Powys Wellbeing programme, that business case has also been put forward. But when you see this slide, you'll also understand there's been a couple of million supported for some of the fundamental things, for roofs, for fire, for infrastructure, for decarbonisation. And I want to just reinforce the commitment to green health and decarbonisation that the Health Board's already made. Next slide, please. This is a penultimate slide, well, two more slides, sorry, three more slides. North Powys Wellbeing Programme, I touched on it, and I'm not going to go into the detail. Again, please do have a look at the slide pack and the information here, but this is one of our flagship developments as part of the regional partnership board, so all the partners coming together working on this. And I think this helps to demonstrate our ambition of the health and care strategy, a healthy caring Powys here in Powys, and takes us considerably further forward. Next slide, please. Communications and engagement has been absolutely critical in our work, and again, we have been able to excel and exceed our own expectations of ourselves, and in particular through the use of digital means, and we've had such positive feedback for this. So thank you very much for all of the people who do engage with us. And I hope that you have really benefited from the information we've been trying to put out to people in terms of the services, the changes, the challenges that we've been dealing with. So huge thanks. And we want to continue that level of engagement going forward. Next slide, please. On governance and assurance, I just will pull out one key thing, and that's that the Health Board has maintained good governance arrangements during the pandemic. It's adapted arrangements to maintain openness and transparency, support agile decision making, and ensure effective scrutiny. And we're committed to learning, and that was the view of the external auditor, Audit Wales. So we're very proud of the work that people have undertaken in ensuring we are running this organisation appropriately. Next slide, please. And then this is my last slide, because that was the year that we have just been through up until the end of March. This is the year we're in now, and you'll be able to see that much of it is a continuation. So the COVID response continues. We are still in the pandemic. It is still a public health emergency, and particularly in the wider sense of this. So essential healthcare that people have had some real difficulty in accessing is a key issue and concern for us, as is our Renewal programme. So what is really key about this is that we have learnt through the pandemic, as well as with our strategy that we already had in place, that we can do things differently and we can get better outcomes and better experience as a result of that. So we have an ambitious programme, 9 areas of renewal that we are going to be working very hard on with and for the public in Powys, and I'm very excited about those developments. We've got a tremendous staff base, both in the health board, but also in primary care, and great partnerships in order to be able to take these things forward. So that's the last slide from me, and I look forward to being here a year on now and being able to share the progress that we've made. And I would encourage people who are listening and have contact with the health board to please track our progress, keep with us as we go forward on this journey and work with you. So diolch yn fawr iawn. I'm next handing over to Pete Hopgood, Director of Finance and IT. Diolch, Pete.
Thank you, Carol. Hi everyone. I'm really pleased to present the Health Board's annual accounts for 2021. If we can move on to the next slide, please. Thank you, Caroline. So against our statutory duty to deliver a break-even position against our revenue and capital funding allocations, against our revenue resource limit, we delivered a small surplus of £143,000. That means we met our statutory duty by not spending more money than we've been allocated. So that's a huge congratulations to the organisation, to the whole board, and to all budget holders for their contribution of delivering against this statutory target. Similarly, we delivered a £27 surplus against our capital resource limit, again remaining within the funding we've been allocated. We did, however, just fall short against our administrative target in relation to the public sector payment policy, whereby we're required to pay 95% of all non-NHS creditors within 30 days. And we fell slightly short, hitting 90, excuse me for that, hitting 93%. Thank you, Caroline. This next slide demonstrates our revenue financial performance over the last 3 years. So we have a statutory duty to remain within our revenue resource limit over a combined 3-year period. If I just draw your attention to the tables at the bottom of that slide, you can see over the last 3 years that we've had a funding allocation and a total spend of circa £985 million. Sorry, Caroline, can we just go back a minute, please? Thank you. So over the 3-year period, with the year 2021 being the 3rd year, we delivered a £263,000 surplus. Again, that's a significant achievement given that we spent £985 million over that period. Next slide, please, Caroline. In terms of capital, similarly, a requirement to deliver that against a 3-year period, remain within our capital resource limit. Over that 3-year period, you can see from the table at the bottom of the slide, we had funding of circa 14.7 million. We've delivered a small surplus of 42,000 against that allocation. So in both the capital and revenue position, fantastic achievement. Thank you, Caroline. In relation to our public sector payment policy, as you can see by the table in front of you, in relation to the non-NHS invoices, we hit a percentage rate of 93% for paying the number of invoices within the 30 days. We did, however, meet the target in relation to the value of the invoices paid. Sorry, we've just gone on again, Caroline. Apologies, the slides are jumping on. So we did exceed the target in relation to the amount of the invoices paid, but fell short on the number of actual invoices. Now, next slide, please. Okay, so where have we spent our money? So what this table here is doing is demonstrating our total expenditure and the key areas of expend. So the first thing to highlight is that in 2021, our total amount spent was 369 million. That was an increase of circa 30 million from the previous year. The main reason for this increase is in relation to our ongoing pandemic response. And at this point, I should note our thanks to Welsh Government for their support in terms of the additional funding made available to the Health Board and to the whole of Wales in terms of meeting that response. So sorry, our slides have jumped on again. We've got some gremlins today. So the key areas of our spend against that 369 million are: one, our primary healthcare services, where we spent 72 million. Then our expenditure on healthcare from other providers, where we spent 176 million. And then our expenditure on our own provider services in our hospital and community, which we spent 121 million. Next slide, please. So now really just got some little bit of further analysis against those three key expenditure areas. So in terms of primary care services, from the slide in front of you, you can see the pie charts which break down the breakdown of that spend and compare year on year from last year and 2021. The blue segment of the pie chart is our spend on general medical services. That is the largest area and is the main part of the pie chart. The next biggest area then is in relation to prescribed drugs and appliances. And as you can see broadly, the percentage spend in those areas is pretty static, but there has been a significant increase around GMS. That has been in relation to dispensing doctors and our enhanced services, and that in part was related to the mass vaccination response and the help that was provided by our primary care contractors. Next slide, please. In relation to expenditure on healthcare provided by other providers, again, the analysis is there to compare 1920 and 2021. The most significant area of spend is with non-Welsh NHS bodies. So this is mainly with our English providers providing that secondary care across the border. You can see that accounted for 36% in 2021, with a slight increase of around 2 million compared to the previous year. Other areas to highlight then, the blue segment, which relates to our secondary care provided by our NHS providers, and then in relation to the grey slide, which is our specialist services and our ambulance services, which are provided by the various committees, and they make up the big chunk of our expenditure on healthcare from other providers. Probably worth just flagging our local authority colleagues. Again, there's been a significant increase in this area, and that mainly links into the combined TTP response that Carol alluded to earlier on in the presentation. Next slide, please. And then this final slide is just comparing again our expenditure 1920, 2021 for our own provider related expenditure in our hospitals and in our community services. I think the big thing to point out here is that the blue segment relates to our pay costs within that area. That won't be a surprise. Our pay and our staffing costs are the most significant element of our provider costs. And then I'm on to the final slide as a conclusion. Again, apologies for the flicking back and forth. It's been testing me to remember which part I'm on, but hopefully it hasn't been too bad for those of you watching. So as a reminder that we met our statutory duties in terms of our financial performance, delivering against our revenue resource limit and our capital resource limit. A fantastic achievement for the Health Board. We did have an approvable IMTP prior to the impact of the pandemic. So again, that's another statutory requirement. I'm pleased to say that the Auditor General issued an unqualified audit report on our financial statements. Again, a good achievement for the Health Board. And as a time of noting, our annual plan, final version of our annual plan is submitted as per the deadline by the end of June for this financial year. Thank you very much.
Thank you, Pete. I think we're going next to Adrian to take questions, I hope, anyway, from people who are watching. So that concludes the sort of presentation element of the proceedings.
Fantastic. Thanks very much, Carol. Thank you very much, Pete, as well for your presentation. So during today's meeting, and actually in advance of it as well, people have been posing their questions to us. So now's my chance to share those questions with Carol, Pete, and with other members of our board here today. And the first comment here is from Carl Cooper, the Chief Officer of the Powys Association of Voluntary Organisations, and he's posted a comment to us today, which is: the dreadful pandemic provided agencies and sectors with an opportunity to rise to the challenge together. Powys has demonstrated that cooperation between organisations and sectors results in better provision, and the Health Board has been instrumental in enabling constructive and effective partnership between statutory and voluntary partners. This is much appreciated and something we aim to develop even further as we look to the future. So I just wondered, Carol, if you wanted the opportunity to respond to that.
Yeah, thanks, Adrian, and thank you very much, Carl. I hope I get enough opportunities, but I'm going to take this one as well to thank you and your colleagues in PAVO, but for everyone across the voluntary sector, whether people are volunteering an hour, a day, a week, a month, or a year, those contributions add up. And they've certainly added up and made a really strong impact during this last year or so. And I think I agree entirely with you, because I think it has been instrumental in enabling a different type of approach, an even more ambitious approach to how we work together and the things that we can do together. And one of the areas in which I think we're starting to demonstrate that is in the Health and Care Academy, and I want to thank you for your own contribution and leadership in that arena. We're working together on the school of volunteers and carers, and this is going to make Powys, I hope and I think, stand out for the value and the contribution we recognise amongst volunteers and carers. And I don't know, I can see that we've got Sarah Powell with us, who is the Assistant Director of Workforce and OD, who's been leading on this. So Sarah, I don't know if you just want to briefly comment on that.
Yeah. Thank you, Carol. Just to say, really, as Carol said, the volunteer and carers is one of the 4 schools within the Health and Care Academy. And we recently, through PAVO, commissioned a piece of work to really develop a strategy around our volunteering that will look at developing an implementation plan for the next 3 to 5 years that will focus on how we can support the volunteers, carers, paid and unpaid, both upskilling, education and training. And as part of the phase of the Basil Webb and the Health and Care Academy, the bungalow will be developed in this financial year, and that will enable us to help look at our assisted living and really bring some technology, some test and trial opportunities for not only our carers but the volunteers that work within our community. So some really exciting things happening in the volunteer arena.
Thank you.
Fantastic. Thanks very much for that update, Sarah. Really look forward to seeing those developments in action over the months and years ahead. Now, our next question is from Councillor Jackie Charlton, and she's also a member of the Community Health Council. And Jackie says, well, a lot of work has been undertaken with partners in a collaborative way across the local authority and Powys Community Health Council. Now, in the future, the Community Health Council will be changing its purpose to become a new citizen voice body, and its remit covering the scrutiny of health and social care. And her question is, do you welcome this?
Well, thanks very much, Jackie, Councillor Charlton, for tuning in and listening. I know you've always had a very keen interest in the health service, so thank you so much for that. Yes is the short answer to that progression of the citizens' voice body. I am wondering if there's going to be a different title for it, mind, but nonetheless, so much of our care now is about joined up care or integrated care, health and social care, hand in glove, that it just makes sense to me that a community health council or successor would look at health and social care. Recognise that's quite a change quite a development. And I also need to recognise that as a health board, we actually currently host the board of Community Health Council, so we know that that will be a change for us as well. But I'd like to push even further, and this is a view that I have shared with government colleagues, in that I'd like to see the join up, not just about a citizen voice body, but also about regulation and inspection. And I know that those areas are looking to join up as well as we move forward. So thanks very much, Jackie, and it gives me the chance to thank all members of the Community Health Council for your work. It's been a very unusual year from which you to discharge your roles and responsibilities as well. And I think we've been able to work in partnership, respecting each other's roles through that year very positively. So thank you very much.
Thank you. I definitely echo that myself. I've been meeting weekly with the chair and the chief officer during the entire COVID period, and the support and challenge from the Community Health Council officers and members has been incredibly useful for us during this time to make sure we're focusing on what matters most. Our next question has come in via email and is from Derek Brown of the Royal College of Nursing. And Derek asks, how has the Health Board complied with the Nurse Staffing Act legislation through the pandemic? And what preparations are in place for the extension of Section 25B of the Act to paediatrics? And I wonder if I could bring Alison Davies in here.
Thank you very much indeed, Adrian, and thanks very much indeed for your question, Derek. Such an important and essential element of any healthcare provision is the ability to access the nursing workforce appropriately. So I'm sure you'll know that for us in Powys, as we have no acute medical or surgical wards that we directly provide, we are not aligned to Section 25B as such, and also that applies to the extension to paediatric settings. However, you'll also know under 25A of the Act, we've got an overarching responsibility to ensure there are sufficient nurses within our own provider services and in those services we commission. So there are sort of three elements to the Nurse Staffing Levels Act we need to be mindful of in Powys. One as it relates to us as a provider, one as it relates to our commissioned services in Wales, and the other our commissioned services in England. And as you will probably know also, at the moment there isn't a law that's akin to those in Wales for English NHS trusts around their staffing levels, but our English colleagues do need to be compliant with NHS England's expectation and those set out by the CQC. And as you will know, in Wales, for our commissioned services here, the Nurse Staffing Levels Act applies to all health boards and trusts that provide nursing services. So in terms of those two elements, we have a commissioning assurance approach. We have a framework that helps us understand the quality and safety, amongst other things, of our commissioned services, including nurse staffing levels. So we have very regular meetings where we undertake that, to gain that assurance, if you like. We also scan board and other reports from other organisations so that we can triangulate all that information together and make a judgment around compliance. In terms of our provider arm, you'll see, and this is expressed in the board paper we presented at the end of May, I think, given this perspective. From our own provider perspective, and we are really eager to make sure that we have sufficient nurses and members of the nursing family on duty to provide good care. So we work with visible senior nurse leadership, we regularly review staffing levels, and we use our professional judgment and acuity levels for patients to help triangulate our perspective there. We utilise ward dashboards to help us understand patterns, fluctuations, and we use hopefully effective e-rostering to support that. We've also got wider programmes around recruitment and retention. We're always eager to attract good quality nursing staff to here in Powys. I hope that provides an answer to your question, Derek.
Thanks very much for that full answer, Alison. Our next question, and I'll give this to Carol if that's okay, is asking, when will the vaccination booster programme begin in Powys?
Yes, thanks very much for that. So about 10 days or so ago now, the JCVI, so the Joint Committee for Vaccination and Immunisation, issued their interim guidance around the booster campaign in the autumn and winter. They have outlined September as a starting point, but clearly are recognising the operational elements and the flexibility that the areas have on that. So currently we are working ahead of schedule, as I explained in the slide presentation, and we will look to, with the right support and permissions, to move into the autumn-winter campaign at the earliest opportunity, but at the latest it will be September. I would also just indicate that we are now vaccinating children who the JCVI have looked very carefully at the categories of children, and we're in full preparation mode to move directly into that. That will take just a few adjustments to enable us to meet the needs of individual children, but we'll be progressing with that as well. So we're very much hoping there's not going to be a break in this vaccination effort. We've made so much progress that we wish to push on, but members of the public can expect to hear in September. For some routes it may be just a tad earlier, towards the tail end of August.
Thanks very much, Carol. And you mentioned earlier about the communication work that we'd done through the vaccination programme, and clearly we'll be making sure that that continues as we move into the booster programme as well, to keep people aware and informed of what's happening and when they can expect their booster as well. Now, I've got two further questions that came in from Derek Brown from the Royal College of Nursing, and actually I know that you cover these within your presentation. So he asked, what's the compliance with PADR and mandatory training, and also what's been the staff turnover during the pandemic? So those were definitely issues that you covered. And he asked, what strategies are the Health Board putting in place for recruitment and retention? So just wondered if there's anything else you'd like to add on that.
Lovely. I'm going to just give a couple of headlines because it was within the body of the presentation, and because I went so quickly, not everyone would have caught it. So PADR, as we call them, that's appraisals. We're currently at around 70%. Now, that is a bit below where we would normally wish to be, but in comparison to other areas in Wales, that's pretty good. And we know that our managers and our leaders are on that. So that was shown in our board report earlier on today. So that's the PADR. On mandatory training, we're at just 79% on that. So again, our target is 85%. We're not quite reaching it, but we're within touching distance on that. And then in terms of recruitment and retention, if I can just say, Powys is closer to people than it's ever been in many ways because of digital technology, and I think that's enabling people to make different choices about where they wish to work. So if you wish to work in an organisation that values people, and I believe that we do, and we've got evidence to show that, and in an area that is aiming to be progressive and work in partnership with others, Powys is a good place to come. But I've just done the pitch. But the other answer to that is our Health and Care Academy, we hope, will provide a huge opportunity for people in Powys to enter into the health and care sector and to make their careers in that sector and be supported with their learning and development as we go through. I know time is short and I could bring others in on that, but hopefully for Derek that helps.
Great, thanks very much, Carol. So you're right, we're approaching the end of today's session, so I think we've just got time for one last question, and I'd love to bring in Claire Madison here, our Director of Therapies and Health Science. And it's a question from Councillor Pete Roberts saying, firstly, can I thank you for the regular discussion and input with the Community Health Council. Moving forward, how do we deal with the long-term conditions linked under the banner of long COVID, as this is going to be a significant challenge? And what plans do the Health Board have to support such patients within Powys, particularly given the huge challenge that some may face if they need to travel outside the county to receive treatment?
Thank you for that question. We've already got a fairly well established long COVID service in Powys. We were involved in the setting up of LongCovered services right at the very beginning, when we realised that the condition was apparent and we had to learn more about it. We've been involved in the national guidelines around LongCovered, so several of us have actually been part of NICE, who set up the definition, and we've also worked on an all Wales basis to set up our LongCovered services. We have a multidisciplinary service that we run from Powys, where we are able to triage people and ensure that they see the most appropriate member of the multidisciplinary team. We recognise this as a new condition. Nobody is an expert yet in this condition. We're learning all of the time, and we have an all Wales group where we regularly meet to share new knowledge and ideas. We're also part of the All Wales research group to ensure we keep up to date with the research. And as you know, we work together to produce an All Wales app which supports people to self-manage their condition. We recognise that fatigue and brain fog and many of these conditions makes it difficult for people to access services. So we are able to see people virtually as well as face-to-face to support them negating their need to travel. We do encourage people to go to their GP first for referral, because with the myriad of symptoms that people are presenting with, it's important that people are screened to ensure that it's not something more serious and they're sent to the right places. Some people will have to be referred to specialists, as always in Powys, and we will send them to the nearest and most appropriate secondary care provider that we would normally send people to. But what we're actually finding is that the majority of people can be managed within Powys with our multidisciplinary service.
Thanks very much for that, Claire. And I've just popped in the announcements section a link to the COVID recovery and rehabilitation services available in Powys as well. Now, as we're coming to the end, Carol, I just wondered whether you wanted a final opportunity to reflect on that and the other questions we've raised today before I hand over to Viv, our chair, who I'm delighted has been able to join us now following the earlier technical difficulties. So any final thoughts there, Carol?
Well, thanks very much, Adrian. When the pandemic started, who knew what we had ahead of us? And even as we crossed Christmas earlier this year and moved into the new year, I'm sure we're all hoping that we're starting to see the end to it. But we simply don't know, and what is very clear is that we will be working on the impacts of the pandemic for some time to come. I hope that in demonstrating the slides and through the report and through our conversation and questions, that people will feel that as a health board we're well equipped and we're always trying to improve the way in which we can work with others, learn and respond to the needs of the people of Powys. There's a lot to be very proud of, and I would reiterate my thanks to people across Powys, across the health board, for their contribution, but also to ask again for your continued support in collectively working as we move forward and the challenges and opportunities that lie ahead. I look forward to being here this time next year and sharing the next stage of the journey. So diolch yn fawr, and I'm very happy to hand over to Professor Hartwood. Thank you.
Thank you. Oh, not another. Diolch yn fawr. Diolch yn fawr I bawb ymuno heddiw. Thank you everyone for joining today. A special thank you to Mel Davies for standing in for me at the start when I just could not get into the meeting, but I could hear everything that was being said, which was great. The questions today clearly indicate how passionate people are in Powys about health and general care. And it's been grateful. I would be very glad to have this opportunity now to add my own thanks to the gratitude expressed by our Chief Executive to so many people. I'm thinking especially now of the medical and related scientific community in Powys and beyond Powys and beyond Wales and even across the whole world. The scientific community has been working tirelessly. I mean, thinking particularly of intensive care, respiratory medicine, immunology, virology, public health, and so on. Unprecedented progress has been made in one very short year. So as Isaac Newton expressed it, all these scientists have been standing on the shoulders of giants, others in the past who have made great strides. So all I can say is what wonderful progress we've made in such a short time across the whole world, not only in Powys. A video of today's meeting will be available online very soon. I'm not sure precisely when, but you would be able to watch that within your communities and share it. Diolch yn fawr, a hwyl fawr. Thank you. Goodbye.